Community health volunteers in an ideal scenario are identified and selected by community members. So then the community health volunteers, after identification and selection by community members, are trained based on the national curriculum on the basics of service provision. And then they are deployed to communities to serve their community members at level 1, which is mainly health education and information giving on various things. In my experience working with community health volunteers, I have found them extremely useful, especially on messaging, where you have to give information to the community. Right now, you realize that there are several myths and misconceptions about COVID-19. And we have found community health volunteers very useful in delivering correct information to individuals, either by word of mouth, through text messages, WhatsApp groups, information materials, and sometimes when we are able to, we call for sessions where they meet one-on-one and share this information. Number 2, they have been very useful in reporting cases of anything that comes up within the community, including cases of infection. We have very good examples with outbreaks such as cholera and how those ones were reported to us through the mechanisms that have been laid by the strategy. And then they also play a huge role in terms of referrals. And these are people who fall sick within their houses, they get to hear about it, and then they would refer them to facilities known to them for the specific care that they will be seeking. And then lastly, they would do follow-ups. Once these people recover, they're back into their houses, they do the follow-up just to make sure that there are no relapses, and if there are any, they make sure that they get the support that they need. During these difficult times when we have COVID-19 and the response initiatives that we need to put in place, community health volunteers must be brought to the table. The reason why is, one, there is messaging. I had just mentioned before that there are several myths and misconceptions about this disease. And every morning when we wake up, you have something new that has been talked about and is being circulated and has gone viral on social media handles. And it takes a community health volunteer to deliver the correct information to their neighbors that are known to them and trust them and the sources from where they get their information. Number 2, they could be very useful in identifying cases. If well-trained, community health volunteers would help identifying suspected COVID-19 cases and reporting them through those laid down mechanisms. Then in the event that we have a positive case, they would play another big role, which is contact tracing. Community health volunteers know each individual who lives in every household where they serve, to some extent by their name, where they work, where they do, where they hang out, their friends and who they associate with. And so if you're doing contact tracing, you need such a person to give you a list of potential people that may have come in contact with a case, and then a follow-up is done. Number 3, you don't need to criminalize this kind of infections. Getting infected by COVID-19 is not a criminal offense and is not a death sentence. And when you send the police to do contact tracing, that's the impression that you get among community members. But if you used community health volunteers to do that, they would follow up as they would normally do for any other case, for the work that they have always done during the engagement. And then lastly, you have to incentivize their engagement so that they are well motivated to continue doing this. As we come together to support each other in making sure that we fight the spread of COVID-19, this is one key group that we must bring onto the table and we must engage them, because the fight against the virus totally relies on people's behavior, and they totally understand how people behave, where they live, and everything that goes on within these communities.